When your child has peanut allergy or any kind of nut allergy, there is a risk for that to become anaphylaxis.
So today on Pediatrics To-Go, we're going to be talking about anaphylaxis, rather severe allergic reaction. So yes, this is where we listen to learn from the mistress.
Okay, in the time period that we have, we're going to try and give you the most important information.
Yes.
Francisca just asked me what is anaphylaxis, and I'm sure a lot of you are wondering what anaphylaxis is. Now, have you ever heard of did you ever hear the story about someone who kissed her boyfriend and then she died?
No.
Okay, there was a child in Canada. This was not too long ago. She had peanut allergies, and her boyfriend had just eaten peanuts, and he's happy to see his girlfriend. Yay, good to see you. Kissed his girlfriend, and the next minute she was dead. And the reason was she had a severe allergic reaction to the peanuts that he had just eaten. Even though he had swallowed everything, he still had the peanut oil or juice or whatever in his mouth, and that was enough to take that child out. Now, it's extremely important when your child is allergic to something to keep an eye out for the kind of allergic response that your child has. Anaphylaxis is a severe allergic response to anything that your body is not does not agree with. And there's different types of allergic reaction. They go from type 1, type 2, type 3, and just for the education and the purposes of this show for this podcast and for our patients to know, when your child has peanut allergy or any kind of nut allergy, there is a risk for that to become anaphylaxis, and that's when you have sometimes a child is exposed to peanuts or something that they don't agree with, and then they can collapse because the body can have a severe allergic reaction where the blood pressure can just drop suddenly. There's the blood vessels just open up very quickly, so all the blood in your child's body pulls to the feet because it loses tone, and then when you have all the blood going to your feet, your child can pass out. And if adrenaline or epinephrine is not given immediately, a child can die. And that's what happened to that girl. She was exposed to peanuts and she had a severe allergic reaction. That's the worst allergic reaction you can have. Something that will kill you just like that. So if your child ever has a history of, oh, I ate a certain food and my face was swollen, there's systems that are involved. Once you have a child who has more than 2 or 3 systems involved, then that child should never go near anything that is similar to that. A doctor recently went to Disney and told everybody in the restaurant, I'm allergic to peanuts. I don't want any peanuts in my food. The problem was in that restaurant, they had been cooking things that had peanuts in it. The doctor ate that food and immediately she ate it. She started feeling faint. She felt like she actually passed out. They gave her epinephrine. They're called EpiPens. I'm sure everybody has heard about EpiPens. Epinephrine is a lifesaver and people can get scared. Oh, it's epinephrine. Epinephrine will save you. That's what we give to children or adults when they pass out. And epinephrine will will close up your blood vessels so that it will actually help to pump blood to your brain so that your brain can get the oxygen it needs to survive. So that lady got a dose of epinephrine. She didn't respond. She got a second dose of epinephrine, but she still died because she had such a severe reaction that the epinephrine was not enough to bring her back. So when you eat something like, I use peanuts because that's one of the commoner things that can cause anaphylaxis. Actually, from my experience, there was a child that came in and almost died because the child was exposed to peanuts and there was a family history of asthma. And because the parents knew that this child the color is looking different because the blood vessels, there was what we call vasodilation. All the blood vessels opened up and prevented blood from getting to the child's brain. So the child was actually out of it and almost passing out. So we had to rush and give EpiPen. And that EpiPen, we give it on the sides. Parents can take EpiPens home. As soon as you see your child is having an allergic reaction, you give them a shot right here. And usually we dispense 2 EpiPens because if you give one, it doesn't work, give the other one. If it doesn't work, then that's a problem. In America, we call 911. In Nigeria, shout for help and ask if there's anybody else that has an EpiPen, because you can give that EpiPen as often as you need to until you get to the hospital.
It doesn't need prescription.
Here in Nigeria, there's no prescription needed, but in America, you need a prescription. I have patients that when they're on vacation in America, they call me and say, Dr. Sanusi, I'm in America, I need an EpiPen prescription. And we call it for them. But here, you don't need a prescription. And you know, sometimes in Nigeria, people go to places and then they eat. And they say, after he finished eating, he just passed out and died. That might be an anaphylactic reaction. But you don't know. You know, so if your child has ever eaten any food that has caused swelling around the mouth, because usually it's systems that are involved. Swelling around the mouth, hives from head to toe, itching, and then difficulty breathing. Whether you see them using their whole body to breathe, that's where it has caused it has constricted the airway in the lungs and prevented the child from breathing. Many of those children, they need to get help ASAP as soon as possible. So when children come in, they have anaphylaxis. First thing we do is give the epinephrine. And then the second thing we do is put them on a monitor, or put them on a monitor first, give the epinephrine. And then that will show us what's happening with the oxygenation and everything. Sometimes they come in, oxygen is 88%, normal is 96 to 100%. So that already tells you that they are not perfusing well. The blood is not flowing through their system because everything has opened away. It's like opening up a dam and all the water is splashing out. But in this anaphylaxis, there's no controlled way that the blood vessels act because the allergic reaction has caused severe changes in the way the body works. So child comes in with swelling of the face, difficulty breathing. Swelling of the face is an itching of the body. That's the skin. They might have vomiting, so even the stomach is reacting to that peanut that they just took. And then they have difficulty breathing, so the respiratory system is also responding. That's already 3 systems: the skin, the stomach, and then if they start becoming out of it, so the skin, there's rashes everywhere, hives, they're itching, their face is swollen, that's all part of the skin. They're having difficulty breathing, that's the respiratory, that's 2 systems: skin, respiratory. Vomiting, that's the GI tract responding to that. It's like a poison, it's like giving somebody poison to them, because that's what the body is responding to. It's almost like a poison in the body. And the next minute they are going delirious or they are acting out of it and trying to pass out. That's 4 systems already. That child needs to get epinephrine ASAP. They need to also get a steroid. They might need a steroid. They might need a breathing treatment. They might also need an antihistamine like your Piriton, which we use in Nigeria, or Benadryl, which we use in America. And then IV fluids. They might need a intraosseous line if we can't get an IV because everything has collapsed. You see how my veins are going. For a child with anaphylaxis, sometimes you don't even see the veins because there's no blood flowing through the body. So the reason I'm bringing it up, parents, check out what anaphylaxis is. Go on healthychildren.org, Google it, see what anaphylaxis is. If there's a family history of asthma or peanut allergy, I would recommend see your doctor and talk to them about anaphylaxis. See if it's something that you need to think about, especially if you have a history of peanut allergy or asthma in your family. So not to scare you, but knowledge is power. When you know, and at the end of the day, you're keeping your children and yourself safe and your family safe. So anaphylaxis usually is an emergency, and once you get to the hospital, your child will get all the care they need. A lot of children, if they've had a severe allergic reaction, they have to be admitted for observation 1 or 2 nights, and then they go home with an EpiPen and they're fine. But always have your EpiPen ready, especially if your child has been diagnosed to have peanut allergy. And other nuts too, like cashew nuts can also cause it. Almonds can cause it. But at the end of the day, you don't want to be a statistic that, the child, after they ate certain food, they started throwing up and their face got swollen and they couldn't breathe, because that is what anaphylaxis will do. So it's always important to pay attention to any allergy your child may have or allergic reaction. And that's why when people come to our office, we say, what are the allergies? If it's fruits, mango, we put it there. So everybody knows this child has, or peanuts, don't go near this child. There's a child with peanut allergy. Don't go near them with your peanuts, whatever. And that way everybody is safe.
Wow, that was mind-blowing. Thank you so much, Dr. Sanusi.
You learned something new today.
A lot. Yeah. I learned a lot.
So anaphylaxis, check out the news, read about the doctor in Disney. went there on her, I think it was even her honeymoon or something.
Oh no.
And she told everybody, no peanuts, no peanuts. And, oh, yes, 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 yes. So it's a major problem. So just be educated and do your best. So not to scare anyone, but it's, the more you know, the better and healthier everybody is. Thank you, mom and dad.
Thank you so much.